A patella fracture is the result of an indirect trauma when the knee is stemiflexed and a pull of the patellar tendon happens against the femur. The patella is embedded with the quadricep tendon to relieve stress from the legs during activities. In simple terms, patella fractures are from the flexion of the muscles above the knee, which overwhelm the patella and then fracture it. Indirect fractures from the patella cause tearing, separation of bone fragments, and then direct fractures of the patella cause bone separation. Signs and symptoms of this injury include pain while walking, hemorrhage, and joint effusion and swelling. Management and treatment of the injury include being immobilized, splinting, and physical therapy for surgical or non-surgical treatment. Avascular necrosis occurs after the loss of blood supply to the proximal femur, resulting in the death of the tissue, causing degeneration and deformity of the joint surface. The patient can sustain the injury by dislocating the hip, certain disorders, using steroids or other medications, or excessive alcohol use. Hip dislocation causes avascular necrosis by damaging the blood vessels in the hip, cutting off the circulation to the bone. And steroids create pressure in the hip bone, narrowing blood vessels in the body, cutting off blood flow. This can also cause apoptosis, which is the death of cells. Signs and symptoms of avascular necrosis include deformity of the affected area, such as flattening, shortening, or widening, joint pain when the weight is put onto the joint, and may occur while resting, and the surrounding joint surface may collapse, or the patient may not present any symptoms until it progresses. Management of this injury includes range of motion exercises, electrical bone stimulation, improving usage of the affected joint, stopping further damage, and possible medication, and becoming non-weight bearing, which means crutches or a wheelchair. A biceps brachii rupture usually occurs near the origin of the muscle in the bicipital groove, caused by a rupture in the tendon due to when the bicep is flexed due to unexpected extension. The rupture in the bicep is normally in the proximal side of the bicep rather than the distal side. The injury can occur while doing bicep curls or an athlete taking a blow to the arm during an event or falling on the arm, while the most common cause is in older patients is typically a strain on the tendon of the bicep. Signs and symptoms of a biceps brachii rupture include a popping or snapping sound followed by immediate pain in the shoulder or bicep after the injury occurs. And then a bulge may be present up here, and then in result, there will be swelling and bruising. Management of a bicep brachii rupture includes putting a cold press on directly to the injury after the injury is present, slinging, anti-inflammatory medication, physical therapy, and then a surgical procedure which includes reattaching the tendon to the bone, which takes 3 months of recovery time. Mono is an infectious disease often transferred through saliva, which can be sneezing, coughing, or drinking and eating after someone. And then it obtains the EBV virus, which is a form of herpes. It can also be transferred through infusions, but it's really rare. Signs and symptoms of mono include fever, fatigue, pharyngitis, headache, cough, rash, loss of appetite, swollen lymph nodes, a sore throat, and an enlarged spleen or puffy eyelids. Management of mono can include dosages of acetaminophen for headaches or a fever or body pain, and then steroids can be used for the patient if the infection is severe. A CT scan can be performed to determine if the spleen is enlarged, and it's most common in ages 15 to 30. A concussion is a head injury that is a result of a direct blow to the head that is hard enough to jostle the brain and make the brain hit the skull. It can happen from impact, moving the head back and forth in a snapping motion, and then being hit with an object when an athlete hits a standstill object, or they are hit by another person or hit the ground. Then it can also be caused by directional injuries such as rotational, acceleration, deceleration, which all cause the shaking of the brain, causing slight breakages in the axial connections, which are the sutures. Symptoms and signs of a concussion include headaches, sensitivity to light, a feeling of being in a fog, loss of consciousness, amnesia, anxiety, irritability and slowed reaction times, drowsiness, and trouble remembering or recalling events. Treatment of concussions should include retaining past information of the patient's head injuries if they have any, no medication for 24 hours for pain so that they can tell you what they're feeling, and remove the patient from any athletic activity, and they should go for 3 days without athletic activity and then build up. Carpal tunnel syndrome is a common injury that affects the patients that use their hands daily, such as piano or guitar players, card handlers, extraneous typing, and athletes that are involved in activities that require repeated wrist flexion. Carpal tunnel syndrome is located in the anterior aspect of the wrist, and the hamate, capitate, trapezoid, and trapezium are the 4 bones that build this part of your hand. And then underneath that is a transverse carpal ligament, which runs along here, and then a median nerve that's right below that, and then there's synovial sheath all through your hand. And whenever you get carpal tunnel, the synovial sheath is what swells up, and it presses on the median nerve, which runs along your arm all the way up to your bicep. And carpal tunnel is caused from using your hands too much or trauma to the wrist, such as a sprain. Signs and symptoms and management. Signs and symptoms include swelling of the hand or wrist, stiffness, pain up to the elbow, sensory and motor deficits, numbness, and tingling. And then management of carpal tunnel includes rest, immobilization of the hand, anti-inflammatory medication, then steroid injections and stretches of the hand, and then a wrist splint if necessary.